And today, under the direction of Dr. Shahab, we are changing our guidance on what you should do if you should happen to test positive with one of those rapid tests. Up until today, we've been telling you that if you test positive with a rapid test, that you should then go get a PCR test to confirm that result, and we're saying today that is no longer necessary. If you test positive, you should assume that you have COVID, and you should immediately self-isolate. The Saskatchewan Health Authority will continue to offer those PCR testing sites across the province as an option for anyone who is experiencing symptoms, and we for sure would encourage people to avail themselves to that if they do have symptoms. But as rapid tests are becoming much more commonplace and much more utilized in our communities, this will help remove some of the pressure off of that Saskatchewan Health Authority testing system, in particular as we look ahead to the next number of days and months. And it will allow for many of those healthcare workers to possibly be providing other services across the health authority and in our communities. And I know someone may be asking, won't that mean that some COVID cases could potentially go unreported? And the answer to that is yes. There could be some COVID cases that go unreported, but we're now at a point of time in this pandemic, and this is not specific to Saskatchewan, but many other provinces are changing the metric in which we are looking at as a key indicator away from the case numbers, the daily case rates, to our hospitalizations and to our ICU admissions. So very much we will be watching those metrics in the days ahead, hospitalizations, ICU numbers, even more so than the case numbers, the daily case numbers that we have. Dr. Shahab has also been reviewing the latest clinical guidance from across Canada and around the world, and based on his recommendation, we are also going to reduce the self-isolation period following a positive test, whether it's a PCR test or a rapid test, from 10 days down to 5 days. So Dr. Shahab will also be making some recommendations about New Year's Eve and a number of other gatherings that may be occurring in and around New Year's Eve, and he's going to speak to those in a couple of minutes. But I would say that today we are not imposing any new public health orders or restrictions or measures at this time. We're continuing to watch our hospitalizations and our intensive care numbers very closely, and we may take further action in the days and weeks ahead, but we are not today as the situation is what we have today.